The differences in epilepsy in the developmental population is there's a very high prevalence of them having epilepsy anyway, because the developing brain is high risk of developing epilepsy, but also the types of seizures that they have might be more complicated, they might be various different types, and in many cases a high percentage might be what's called like medically refractory. So the medication that they're getting may not really always work. So it's important for the doctors, the neurologists, to really appreciate the complexities of those with intellectual and developmental disability with seizures because of all these different things, but also what makes it even more difficult is that if they're having side effects, so if you're giving a medication to someone with an intellectual developmental disability and the side effect could be it's making them tired, or it's making them stomach upset, or it's making them dizzy, how would the doctor know that are actually having side effects if the person with a developmental disability is poorly communicative or even is nonverbal? So how would the neurologist, I'm being like rhetorical, how would the neurologist be able to assess them or be appreciative that side effects are very common, especially when they have a developing brain that already might have difficulties already with intellectual disability or behavioral challenges? So there's a lot of complexities that make people with developmental disability and epilepsy a lot more complicated and different than other types of people with epilepsy.